All right, good evening, everyone. Good to be back and having our D2 meeting. We missed last month, but we're back at it this month with our speaker, Roberta Jump. She will be speaking to us today on diabetes and autoimmune inflammatory disease. You probably have seen Roberta give us other presentations, so you know she's full of a lot of knowledge in all subjects diabetes related. So I'm sure this will be a very good presentation. Roberta, take it away whenever you're ready.
All right, thank you, Natalie. And I guess if we get disconnected because of the weather, we can just try to reinstate the connection.
Yes.
Just do our best.
Yes.
Okay. Well, again, today we're going to talk about diabetes and autoimmune inflammatory disease because there's a lot of people that are experiencing this and they're asking a lot of questions. You know, how does this affect me with diabetes? How does it affect my family that maybe have diabetes or maybe don't have diabetes? So this is really good information for everyone. And this information is taken by based on an article by Dr. John Clark. He is a preventive medicine expert, and his website, northernlightshealtheducation.com, is the resource for this presentation, and he has probably 4 pages of references. So if I say something and you say, I'd really like to look that up and check that out, you can just go to northernlightshealtheducation.com and all of the references are there for you. So the first question we may have is, what is autoimmune disease? And naturalnews.com describes it as, is defined as an irregular response of the body's immune system against substances and tissues that are normally present in the body. So it's the body responding to things that are normally in the body, but it's an abnormal response. So what is our immune system? Well, we have different stages. We have our skin as our first line of defense. Every square inch of our skin consists of, this is unbelievable, 19 million cells, 60 hairs, 19 feet of blood vessels, 625 sweat glands, and 19,000 sensory cells. And they can transmit information at 200 miles an hour. Beyond that, our second line of defense is that we have antibodies from our immune system that protect our nose, our sinus. So the body does its best at the skin level, and then also in the digestive tract and in the respiratory tract, trying to keep anything from getting into our system that is going to harm us. So we have a lot of great layers of defense. So normally on the inside of our bodies, our immune system has the ability to fight off any invaders that it considers as, you know, something that's attacking our body. If it's something that we've had before, you know, there's many different types of cold viruses. So if we've had a cold with a particular virus in our life, or if we've had a particular type of flu, our body has developed an immunity to that. And so when we are in the vicinity of that virus, our body doesn't have any trouble fighting it off. But if there's something that really attacks our body and our body is not familiar with it, our body tends to take out the big guns, and it shoots anything that seems to be out of place. And that type of immune system response is called inflammation. Sometimes it's a good thing, you know, when we get a cut and our body, you know, inflames the cut and it sends, you know, the white blood cells in order to heal that wound. That's a good thing. But if we have a huge immune response, especially against the body itself, then the big guns come out, and then the body just, it just goes crazy. And it especially is active with any kind of any injury, any antigen, which is something that triggers an immune response, an unknown bacteria or virus. So there's a lot of collateral damage that happens when there's something that the body has not seen before, and it tries to just to strengthen the body against infection. So when we have diabetes, or someone that has an immune system that's compromised, not working properly, when we are exposed to anything that causes an infection, our body can't deal with it as well as someone who has a strong immune system. And so we get this sledgehammer effect, and the body just goes into overdrive. There's too much of an inflammatory response, and it acts like a sledgehammer. And so what we start seeing is the body attacking itself because the immune response is so strong. Does that make sense so far?
Mm-hmm.
Yes.
So what could cause some of this inflammation? So again, if we don't have an immune system that's in optimal health, and with diabetes, we see a lot of folks that don't have a very strong immune system. Sometimes there's situations with a hostile antigen, and that means a leaky gut. So we have some holes in our intestinal tract, and things get through from our intestinal tract into our bloodstream. And so the body overreacts because we've got too many of these antigens stimulated. If it's bombarded on many sides with many different types of disease causing things, it tends to overreact. A secret trigger, I don't know if any, the author really did not say any examples of the secretly triggered inflammation process, but it may be something that has to do with perhaps a drug that we might take or an injury that we might sustain that the body doesn't know about. And then one of the main ones is oxidative stress. So when we say oxidative stress, oxidation is a rusting process. So whenever we have a piece of steel, oxygen is exposed to the steel as well as moisture, we see this rusting. And when this happens in the body, it's called oxidation or oxidative stress. And this is one of the things that's one of the biggest causes of inflammation in the body is this oxidation. And so we're going to talk about how to avoid that in just a few minutes. So here are some examples of autoimmune disease. So do you know anybody with any of these types of diagnoses? You don't have to give any names, but just say no. I mean, just say yes or no if you know anybody that has these things.
Mm-hmm. Yes.
Lots of
Lots of people. Okay. And
yes.
a lot of times we see these diseases diagnosed in our loved ones or people we know, and we wonder to ourselves, I wonder where that came from. And a lot of us really don't connect it back to what we consider autoimmune disease. But all of these things can happen from some of the things that we're going to talk about, some of these causes. So here's some of the things that promote autoimmune disease. Again, our immune system, if it's not 100%, heavy metals. I don't know if you've heard about heavy metals can cause problems in the body and increase inflammation. Things like lead and mercury. Mercury can increase inflammatory tissue damage by 50%. So that's a big, huge risk. Some of these other heavy metals, we really don't think about taking them into our bodies because we don't see them on labels and things, but sometimes they can be in the food processing process. Sometimes they can be in prescription drugs or supplements that we take. Sometimes they can be in the air. Next one is stress. Do you know anybody that has any stress?
Yes.
Maybe.
I think we all do, right? Especially
Mm.
nowadays, we pull up to the gas pump.
Yes.
Yes.
So if we have some emotional stress, if we feel burned out, if we just feel like we're just always going and going and we're never having any rest, this could allow our body to be responsive to some of these inflammatory factors, and it could allow for inflammatory disease. So we may be doing some exercises and just mental kind of relaxation that we need in order to overcome this burning out and this emotional stress. If a person has experienced a major stressful life event within the last 2 years, the risk of them developing autoimmune disease is increased by 140%. That's how powerful stress is. So that's why it's important to try to balance our lives and try to get this, relieve the stress if we can. Oxidative stress, we talked about that. We'll go into detail a little bit more. But whenever we have oxidative stress, that actually kills our cells. And when our cells die, then the dead cell, the DNA from the dead cell, our immune system can make antibodies to that. And again, if it's too much, if there's an overload, then it can just blow up and become an inflammatory disease. The last point on this slide is when we lose sleep, or if we have poor sleep quality, this can increase inflammation in our body. So as we age, I know a lot of us ladies, as we go through menopause, it's just hard for us to sleep or stay asleep. Some people are so stressed at the end of the day, instead of going to sleep on time, they stay up and they watch movies and they don't sleep well. Sometimes we have sleep apnea and we don't know that anything about that, or we're not breathing properly when we sleep. And so it really builds up the inflammation in our body, and we're really not aware of it. A lot of people don't think that, a little bit of sleep loss actually matters, but it really does. So sleep is important. So there's some drugs that can increase our risk for autoimmune disease. Estrogens, and these are ones that are, given, not the estrogen that occurs naturally in our body. Oral contraceptives can increase our risk by 90%. Hormone replacement therapy can increase our risk by 150%. And so these are not just in maybe prescription drugs that we receive, but they're also in animal products and chemicals that we find in the environment. So if we're taking oral contraceptives or hormone replacements and we're being exposed to some of the things in the environment, then that's a double whammy, and it can actually increase our risk. Just that, if you have a question, go ahead and ask. I'm just going along. But if you have a question, please ask. How about hair dye? Oh no. If we have hair preparations, especially things like soaps and shampoos that have sodium lauryl sulfate, it's used as a foaming agent, I think. When they're in our products and it touches our skin, it could actually increase our risk. Food preservatives like BHA, food additives that emulsify or thicken, things that plasticize the ingredients, I probably wouldn't buy it. Should have some ingredients that we are familiar with. Things like that are alkaline, that are baking powder and baking soda, they make the stomach work harder because our stomach wants to make stomach acid in order to digest our food. And these are alkaline, so they work against the stomach acid and they make the stomach work harder and can increase the risk of stomach cancer by 190%. And so whenever we bake, we can use yeast instead of our baking powder and baking soda, and that decreases our risk. How we treat our skin is extremely important, because whenever we have a lot of waste products that are accumulating on our skin, then our body can reabsorb those, and those are now toxins, and they can cause inflammation. And so a lot of folks, we really don't want to go out and sweat. It's just uncomfortable to sweat. We want to stay in where it's cool. And so a lot of times we just have toxins building on our body. We have some things coming out of our pores all the time. But if we don't really sweat and kind of flush those things out of our pores, then they can accumulate and cause inflammation later on. So if we thoroughly scrub our skin when we take a shower, just scrub it really good to try to get all of the toxins off. We can brush our skin too, so you can get a skin brush and you can go from your feet up toward your heart. That's that you want to do that. So you just brush up from your feet up toward your heart, from your hands up toward your heart. And that way, that can actually get rid of some of those toxins that are embedded in the pores. And you can do that in the shower before you turn the shower on. So you can just get in the shower, brush your skin, and then when you take a shower, you can scrub your skin, and that does a really good job of cleaning the skin. And then also sweating. So, some people like a sauna. Some people don't mind getting out when it's a hot day and sweating, but that's one of the best ways to try to flush those toxins out of the skin.
Roberta, can I ask a question?
Yeah, sure.
So I was reading up not so long ago about that skin brushing. And just like you were saying, like scrubbing from your feet up towards your heart, does it make a difference if you don't start from your feet up?
Well, you're actually helping the lymph to move up, so it doesn't really, it helps your circulation a little bit, but when you're brushing up, it helps your lymph, and your lymph system helps to get toxins out too. So brushing up toward your heart helps that the toxins to come up, and then your lymph glands and lymph nodes can flush out a lot easier. But I would say that if you brush your skin in the wrong direction, it's probably better than not brushing your skin at all.
Oh, okay.
Does that help?
Does it have to be in a circular motion, or does it matter?
Straight up, just a brush
Straight
up,
Okay.
like you would with a razor, shaving your legs.
Oh, okay. Okay. Thank you, ma'am.
Long strokes. Good. Thank you for the question. So aflatoxins in our food, they are formed in the process of aging or fermenting, and they're a source of inflammation. Fermented and aged things like cheese, wine, vinegar, and pickled foods. And vinegar is really a point of contention because we see a lot of folks promoting vinegar, apple cider vinegar to drink. But vinegar is actually used in the labs when the scientists want to create inflammation in the intestines of the lab rats. They'll use vinegar. And so a very good substitute for vinegar in our cooking would be lemon juice, which is excellent. It's a citric acid instead of acetic acid, and it's much better for our body, our kidneys, and our liver than using vinegar. So whenever we use pickled or aged foods, then the aflatoxins that might be in there could cause inflammation. And then we all know about mold, when if we're ever around homes and buildings where we might see decaying leaves or compost heaps, and we know mold when we see it. And we definitely want to stay away from that, because if it gets in the respiratory system, then it definitely affects the body and can cause inflammation. So perfect health depends on perfect circulation. And when we have slow blood flow, because our blood flow is congested or slowed down, and this could be with diabetes, if our blood sugars are high, that makes a sludgy blood flow. But other things that could impair our blood flow would be a sedentary lifestyle. So if we're just sitting at the computer all day or sitting on the couch, we're really not moving and circulating our blood. When we wear tight clothing, that slows digestion, and depending on how tight the clothing is and where it is, it could also impair our circulation from our lower extremities back up to the heart. If we have cold extremities, if our feet are always cold or our hands are cold, then that makes more blood stay in the central part of our body, and it causes it to coagulate and to kind of congest in that area. Not coagulate, that's the wrong word, I'm sorry. It congests in the mid part of our body, and our blood pressure typically goes up because we're not having that full body circulation when our extremities are cold. So it's important always to keep our feet and our hands from being cold. Overwork of the brain in the absence of outdoor physical exercise, again, that relates to being sedentary. So we're working our brain, we're stressing our brain out, creating that stress that we talked about. And a good outlet for stress is exercise. We know that from a diabetes standpoint, to lower the blood sugar, it's a good idea to do some exercise. It's also very good looking at fighting inflammation. If that actually reduces our risk of inflammation in the body. And then shallow or improper breathing. How many of us don't really think about our breathing? We just kind of breathe in and out, just using the top part of our lungs, when really we should be sitting up a few times or as much as possible and breathing in as much as we can, filling our lungs full of air, and then exhaling. And that actually helps with the circulation in the respiratory tract. Definitely helps to reduce the risk of inflammation. So do your deep breathing. I think we talked about that in one of the other presentations. Repetitive or forceful tasks can cause tissue microtraumas. So if we're just doing the same thing all the time, I was just thinking of chopping wood, or maybe a pitcher, a baseball pitcher, and he just continues to do the same movement all the time. You get the shoulder injuries, the microtraumas. I don't know if this would pertain to maybe working at a desk and having, working with your hands on the computer, like carpal tunnel syndrome. I don't know if it would include that. But, huh? Did you say something?
I
Okay.
said that, yeah, you know, if you work on a computer using the mouse, definitely it is repetitious on your hand.
I know that after about 10 years of working on the computer, I just had a lot of pain in the lower part of my thumb, and I have to sometimes just relax it. So it might include some of those smaller micro traumas as well as the pitcher or the person that is chopping wood. If we strain our voice, that could cause inflammation in the throat, in the voice box. And then we have some indoor air contaminants. So it's good to get a nice filter for your home for the air conditioning system. Some of these toxins can be in our home and they can cause inflammation as well. Uh-oh, diet. Here we go with diet. The Western diet can increase our risk of inflammation by, look at that, 210%.
Ooh.
So we see a lot of high fat types of foods here. And then snack attack, you can see this young lady on the bottom, she's having a nice snack there. And a lot of these foods, the fried things, the salty things, the processed foods, the sweets, the candies, and the desserts. Now, does this mean you can't ever have these things? No, it doesn't mean that. But how many people do we know that have these types of foods as their diet most of the time? You know, they're eating a lot of processed foods every meal. They're having, you know, fried and salty and sweet things for snacks. And the body just gets to the point where it can't handle it and it really develops the inflammation. So it doesn't mean we can't be full and watchful of them because they can increase our inflammation and our blood sugars, right?
Yes.
Some of these things, these spices, pickles, again, we're looking at vinegar. Too much salt can increase our blood pressure and cause kidney injury. Down towards the bottom, we see red and black pepper. Red pepper increases our stomach acid secretion by 700%. And so folks that use a lot of pepper, they might have more issues with reflux. And so you get that inflammation in the throat. And that could cause a whole body type of response when we have just this constant inflammation all the time. So some of these really very salty, very sweet, very fatty, fermented with vinegar things, we should just use them very sparingly and not have them as, you know, most of the time that we have our additives to our foods. So if we're low on our fiber and we have some deficiencies in some minerals, this could cause inflammation too. And so magnesium, we see magnesium really low in a lot of people that have diabetes because magnesium is necessary for our body to take up and use sugar. So we see these low magnesium levels. Definitely talk to your doctor about taking magnesium. I mean, it's available over the counter. I take it every day, about 400 milligrams, because I know that I tend to stay low on it. So if we're low in that, that could contribute to inflammation. A lot of times when we get caught up on our magnesium, a lot of people's bathroom habits and bowel movements are regular because magnesium helps us with that as well. Sometimes we're low on zinc, and we can find that in pumpkin seeds. We're low on selenium, and we can find that in Brazil nuts. And we only need about 2 Brazil nuts a day in order to get the selenium that we need. So they're expensive. Last time I looked, they're about $7, $8 a container. But if we're only eating 2 a day to get the selenium that we need, it's worth it because that container will last a long time. Fiber, how much fiber should we eat? Do you remember from your classes? How many grams a day should we have of fiber? Any guesses?
45.
You said 25 or 45?
45.
That's a great guess. A lot of times we hear from diabetes educators and dietitians that we should have 30 grams a day. But more of the recent studies are showing that if we can get up to 45 to 50 grams a day of fiber, then not only will our blood sugars be much better controlled, our appetite will be controlled, and we can reduce our risk of inflammation. So where do
Vegetable.
Vegetables are high. Very good. What else?
Oh,
Ice
good.
cream. I'm just kidding.
I knew you were.
uh,
Some nuts have a
Nuts, yeah.
grain,
Yeah.
grain, and
That's it. Whole grains. That's
Grain.
right. Whole grains
Yeah.
and fruits. And the number one plant food that's the highest in fiber per ounce is beans, like pinto beans, kidney beans, black-eyed peas, those types of beans. So beans, nuts, and seeds, and whole grains, and fruits and vegetables. And if that makes up most of our diet, we're going to have plenty of fiber. Stimulants in our diet can also contribute to inflammation. Caffeine, and the statement that's in the article that I drew this presentation from says, once inflammation starts, caffeine can accelerate it by 300 to 600%. So that's really substantial. Chocolate can increase by 150%. So I don't think I'm going to cut my chocolate out, but I might just cut down on my portions, right? Alcohol, 90%. Wine is especially aggravating because it is fermented, like vinegar, and it could even increase such inflammatory diseases as asthma. And then smoking can increase it by 65%, even secondhand smoke. So it's really good that smoking really has been eliminated in places like restaurants. I don't know if you're old enough to remember that you could walk into a restaurant and you have a smoking section and a non-smoking section. So it's good that we don't have to be exposed to that.
I agree.
So any comments on this slide or questions about this slide? All right, so you got your fiber number there, 50 grams a day. All right, this looks like it's frozen. Let's see if it'll go back. I'm going to stop the sharing and see if I can pull it back up. Sorry about that. All right, current slide. Now let me go down here. I'm sorry, I'm off kilter here. Talked about that. We go here. All right, now, oh, how about donuts?
Yeah,
Donuts are,
Roberta.
I know, it's terrible. Donuts are a huge source of something called AGEs, and that stands for Advanced Glycation End Product. Foods, the extra sugar sticks to things, and that's called glycation. And so when the sugar sticks to some of our cells, the end products of that, the cell just gets full of sugar stuck to it, and it causes, a big inflammation in the body just because of all that sugar that's stuck to it. And, when sugar sticks to things, it makes them sticky, right? So cells can clump together and can cause inflammation. So a slice of a 100% whole wheat bread has about 536 AGE units. They look at AGEs as units, while a plain glazed donut has 425,000 AGE
Wow.
units.
Good God.
And to make it worse, fructose, which, fructose is in fruit. And I went to a diabetes seminar recently, and they really focused on fructose because we see so much high fructose corn syrup in our food. Fructose is not metabolized like sugar is, like glucose is. It has to go through the liver. And so if we have too much fructose, then it builds up in the liver and it could cause liver disease. I don't know if you've heard the term non-alcoholic fatty liver disease.
yes.
One of the main causes for this is high fructose corn syrup, because it's about 70, 80, 90% fructose and just a little bit of glucose. If we have table sugar, it's about 50% fructose and 50% glucose. So it's a little bit better. But when we, so if we have a lot of fructose in our diet, this not only builds up in the liver, but it causes Do you have a question? Did you have a question?
But you know, you can't save anything. You can't save food that way. Cause I told him,
I didn't know if she was talking. Okay. So, so the fructose can cause liver issues, and it could also cause inflammatory markers in the blood. So,
Ms. Jepp, let me ask you a question concerning the slice of whole 100% whole wheat bread. Is 536 AGE units, is that
Right.
considered good or bad, or?
that's considered fine. It just means that, you know, the things that are carbohydrates are going to turn into sugar.
Mhm.
And the whole wheat bread is going to digest more slowly, and the sugar from that bread is going to go into the system very slowly. And that it doesn't make your blood sugar rise too high. But something like a donut is going to make the blood sugar shoot up high. And when the blood sugar shoots up high, it has more of a potential to stick to things, much better than if you have something that keeps the blood sugar nice and steady like the whole wheat bread. So 536 is not bad.
Okay.
And if you like, you know, you can just go on to Google and you can just look advanced glycation end products. And there's a lot of great information about how they rate them and, you know, the things that would, you know, cause more of a problem. And most of the time it's just processed foods, especially those that have high fructose.
I'm gonna have to hang up because I can't hear them.
Okay.
Ain't that doing me any good?
So that's a good question. Trans fats is the next worst thing. So two worst things that are going to hurt us in our diet would be our trans fats and our high fructose corn syrup. And trans fats are basically fats that started out as a good oil, like cottonseed oil or palm oil or corn oil or soybean oil. And what they do is they heat that fat up to about 1200 degrees, and then they shoot hydrogen into the fat. And that turns it from a liquid fat into a solid fat. And so it's called trans fat because it's translated or transferred or I forget the exact term, but it's changed into a hard fat. And so this type of fat is more harmful than even butter because it causes just as much heart disease, but it could also cause different types of. Natalie, I don't know if she knows that she can be heard. Is there a way to mute her?
Yes, I'm gonna check on that right now.
Okay, thank you. So, so when we have a fat that we put into the refrigerator and it becomes solid, then that's going to be more solid in our arteries. It's going to cause more inflammation, and it's going to cause this oxidation that we talked about. So whenever we take an oil that maybe it was already heated to 1200 degrees, and then we reheat it, like we deep fry something, or we fry something in a pan for a long time. So it's the length of time that we fry it, it's the temperature that we fry it, depending on how much inflammation that causes. So the hotter the oil, the longer time we cook it in the hot oil, that's going to cause the most damage. So if you're going to stir fry something for just a couple of minutes, just to kind of get it crispy on the outside, that's not anywhere near as bad as deep frying something for a very long time. Does that make sense?
Yes.
Now, here's where oxidation is important as well. If we have a food with cholesterol, there was a study where the gentleman had taken some cholesterol that was freshly, it was fresh cholesterol, was cholesterol from something that was freshly prepared. It did not cause as much inflammation as the cholesterol that was hanging around for a while, and oxygen had a chance to attach to it. So anytime cholesterol is sitting around, or anytime cholesterol is, if it's any way like sprayed or mixed into something and it has a chance to attach to oxygen, then when the oxygen attaches to the cholesterol, that's much more deadly than cholesterol that's fresh. So let's say you have a piece of fresh red meat and you grill it. There's cholesterol in there, and it's not the healthiest thing, but it's not oxidized cholesterol. But if we have the cholesterol in an egg yolk, and then that egg is turned into a powder and then it's spray dried, there's a lot of air that can attach to the cholesterol in that egg powder. Or Parmesan cheese, there's cholesterol in the cheese, but if you ate the cheese fresh, it wouldn't be as harmful as when we take that cheese and we grate it, and then the oxygen has a chance to attach to all those little particles of cheese. Butter and ice cream and sausages and tallow, they're all mixed in a mixer. They're blended. And so any cholesterol that would be in the whole milk to make the ice cream, that cholesterol is going to be, oxidized.
What
So
is beef tallow?
it's just beef fat. It's like the beef equivalent of lard.
Oh, okay.
And so it's usually processed in a way where it's like stirred and blended, so air can be introduced into that product, and then the cholesterol in it will react with the oxygen. And this is one of the highest inflammatory types of foods that there are. So anything that had cholesterol to begin with, that was spray dried, blended, aerated in some way, it's going to be much more harmful to the inflammatory process in the heart. So any other questions about this slide?
This is really new to me. I've never heard that.
Yeah, it's very interesting. And Dr. Clark is a lifestyle physician expert, and he, does a lot of studies. And like I'm saying, these things that I'm saying, there's 4 pages of references. So if you go on to the Northern Lights Health Education website, .com, northernlightshealtheducation.com, there's all of the studies, all of the references. And this is really important because a lot of times we don't hear this. We hear more about don't eat sugar, but what about folks that are on a keto diet? Eat all the sausage and hot dogs and cheese and butter that you want. And all of these things can cause tremendous inflammation. So much better to eat the high fiber foods and then watch your carbs, yes. But even more importantly, we want to watch, the processed foods and the higher fat in the blended cholesterol oxidized types of foods too. If we eat the same thing day after day, the body kind of develops a tolerance, and it could lead to inflammation. Many foods at one time, that could cause inflammation, because when we eat something, that lets the brain know what's coming down into the stomach. So the brain signals the stomach, hey, this person is eating some lettuce. So the stomach gets ready to digest the lettuce with all of the enzyme specific things that it needs to digest the lettuce. If you have a salad, then the tongue tells the brain there's lettuce and tomato and cucumber and olives and peppers. And the body just tries to scurry around and produce everything it needs to digest all of those foods. And if you go to a buffet, oh well, the body can be overwhelmed. So if we eat the same thing, if we never have variety in our diet at all, or if we have too much variety at one meal, both of those things are not the best things. Good to have variety, but then maybe only have 3 or 4 things at each meal. And that way the body can focus on just digesting those things and not being overwhelmed by many.
Eating the same thing all the time is not good.
Foods that have a high glycemic index can be inflammatory. So if we have a bowl of cornflakes, hey, that's healthy, right? Cornflakes are healthy.
Yeah, like a healthy breakfast.
Cornflakes, skim milk, white toast, and orange juice converts almost instantly to 16 teaspoons of sugar. And that's kind of like it goes to answer your question, Curtis, about the AGE. I don't know what the exact AGE index of that would be, but it would be high because this food is converting to sugar instantly. Does that make sense?
Yes.
So anything that raises your blood sugar fast is going to make a lot of extra sugar that's going to stick to things. And so the sugar sticks, and they call it glycation. So what foods are high glycemic? What can raise your blood sugar fast?
Well, a lot of people take an orange.
Orange.
Which would raise your blood sugar faster, the orange or the orange juice?
Orange juice.
That's right. And why is that? What's in the orange that's not in the orange juice?
or vitamins in the orange
Fiber,
juice?
there's fiber in
It's-
orange.
Fiber, that's right, you're right. So the
Yeah.
orange has the fiber, which is going to slow down the digestion, less blood sugar going up fast, and less AGE index. So how would we make this breakfast a little bit higher in fiber and a little bit more healthy and better for the blood sugar? What could we substitute for the cornflakes?
Oatmeal.
We could have oatmeal. Excellent. What else? How about bran flakes?
Bran flakes, yes.
There's some
Bran
fiber in there. Okay.
Yeah.
Skim milk is okay. Okay. What can we switch for the white toast?
Whole wheat.
We can have whole wheat toast, and then we would have, you already mentioned our carbohydrate, but it's going to make the blood sugar stay more stable instead of shooting the blood sugar up. Does that make sense?
Yes.
Mhm.
All right. So sometimes people have food sensitivities, and if a person has a gluten sensitivity, a person with autoimmune disease has 10 times of a higher sensitivity to gluten. And I've said all along, I don't think it's just gluten, but I think it's a lot of the Roundup that's put on the wheat, the glyphosate, that goes along with the gluten, and that combination really causes people to react because people have been eating wheat for centuries. Yes, it's been hybridized and GMO'd. So it's different that way, but I think it's the gluten along with the Roundup or the glyphosate, I think causes more problems. It causes holes in the intestine, and then we have more things going from the intestine through to the bloodstream that should not be there, and that causes the body to have another inflammatory response. So whenever we have wheat, if you can find it, the two best types of wheat, if you want bread, have you heard of Ezekiel bread?
Yes.
Ezekiel bread is in some of the grocery stores, not in all of them, and it's in the frozen section. And I probably wouldn't eat it right out of the freezer. I'd probably toast it. It's good toasted. But that wheat it's not GMO, it's heirloom only, and it's not sprayed with glyphosate. And if you want to get your own wheat and grind it into wheat flour or buy the wheat flour, you want to look for Wheat Montana. And that is non-hybridized, it's non-GMO, it's organic, and it's not sprayed with glyphosate. So that way you can, if you have a gluten sensitivity, or if you know somebody that does, and they try the Ezekiel bread or they try the Wheat Montana and they don't have that reaction, then they know it's probably more of the hybrid wheat and the glyphosate as opposed to the wheat itself. So any question about that?
Yeah, well, can you explain what gluten is? I still don't have a good concept in my mind of what is
okay.
gluten?
Gluten is a protein that in
Okay,
wheat
protein.
and a couple of other grains. I think barley has gluten. Oats do not. Quinoa does not. I think it's mainly barley and wheat. And basically it's a sticky protein, and it's what makes wheat stick together to make bread. You know, did you ever try to make bread out of cornmeal? It doesn't stick together,
No.
right? Yeah. And so gluten is that stickiness. It's a sticky protein that makes that wheat stick together. But in some people, it can cause a sensitivity. And like I said, I don't think that has always been the case, because people all around the world have eaten wheat for centuries. But with modern, GMOs and starting to see more sensitivity. So I don't know if it's the gluten itself or whether it's just the way that the wheat has been hybridized or treated. Does that answer your question?
Yes. All right.
Just
Thank
a
you.
protein. It's a sticky protein. Okay.
Thank you.
When we eat red meat, there's two different types of iron. There's heme iron and there's non-heme iron. Heme iron is very common in red meat. That's why, when people are low in their iron, they'll say, oh, eat a steak. And that kind of iron, you might need that if you're anemic. So you can have that if you're anemic. But if you're not anemic and you're eating the heme iron all the time, then it could increase risk of inflammation. So when we have our red meat, just enjoy it every once in a while. But if we eat it all the time, it might cause more of a problem. There's some antigens in animal products. Whenever we have dairy, we have 1200% increase in risk of inflammation. And we see a lot of people, they're dairy or lactose intolerant, and that could cause inflammation in their body on top of the hormones and things that they put in there. Eggs can raise our risk 600%, pork 460, and fish 400. So that's just the antigens that are in the animal products. So again, you know, we don't have to cut them out completely, but someone that's on a keto diet, this is pretty much all they're eating, and there's a lot of inflammation building up. Too much protein elevates our risk, and we talked about too many foods at one meal. It's good to have a variety, but not too much at one time. Overeating, so if you have a burger like this gentleman here, then you know that would cause a problem. So the more we eat, the more we eat too many calories, we get more of this fat that accumulates in our abdomen. And every 1% increase in our visceral fat, that's the fat that surrounds our organs in our abdomen, it increases our risk for autoimmune disease by 140%. Trichinosis, which is a parasite from eating pork and bear. I don't know how many people eat bear, but a lot of people eat pork. But it's one of those parasites that can cause muscle pain or joint pain or muscle weakness. And sometimes the person is diagnosed with autoimmune disease when really it's trichinosis. So it's best to not eat pork at all, but if you eat it, make sure that it is completely and well cooked because you definitely don't want any living parasites going into your muscles, because that's a lifetime of pain and discomfort. And then there's also viral and bacterial infections that could cause inflammation, like salmonella or E. coli. If we have irregular work shifts, and there's some employers around this area that make their employees day and night shifts, and that really interrupts our rhythms, our natural rhythms, and it could cause inflammation. Some vaccinations can promote autoimmune disease. MMR has been shown to cause some inflammation. Just an example, receiving a hepatitis B vaccine increases the odds of acquiring multiple sclerosis by 420%, lupus by 810%, and rheumatoid arthritis by 1700%. So be careful, you know, when you consider vaccinations, especially how many you're having all at one time. So if you're going to have a few, let's say you're going on a trip and you have to have these vaccines in order to go overseas, try to space them out. Try not to have all of them at one time, because they could really build upon each other to cause inflammation. So whenever we have a deficient immune system and we start seeing some of these autoimmune diseases, some of these results we can see: infections, pneumonia, tuberculosis, congestive heart failure, 90% risk increase with autoimmune disease, cardiac arrest, 95% increase, heart attacks, 220% increase, osteoporosis, and cancer. So these are the outcomes of having initially the deficient immune system and then adding these lifestyle risk factors that we talked about earlier. So what can we do? We've given you all the bad news, right? So what can we do to try to help us not get into this situation? Well, if you get up in the morning and you get some exercise in the sun and the fresh morning air, especially if you're near a body of water like the lake or a stream or a river, sun is coming up, you're breathing fresh air, you're by some water. And the reason for the water is the water has something called, water in the air, it has negative ions. And when the negative ions are breathed into your respiratory system, it decreases a lot of the inflammatory risk. So it's very good. Sunlight can reduce inflammation in the body. So just the sunlight hitting your skin can affect what goes on in your body. So aim for 25% of your skin to be exposed to the sunlight for 20 minutes each day. The darker the skin, the more you want to expose to the sunlight. You can add maybe 20 more minutes for, shades going a little bit darker. If you're in the sun for 20 minutes and you tend to burn, then you can reduce that to 10 or 15 minutes. Exercise can reduce inflammation. And we talked about the clothing. We want the clothing to be well-fitting, but we don't want it to be too tight. We want to keep our circadian rhythm in balance. We want to go to bed at the right time and get up at the right time. So a lot of people really don't like this when I talk to them. Bedtime no later than 9:30, and then sleep. Try to have your meals about the same time every day, and try not to eat later than 5:30 p.m. if you're on a day shift, and try to regulate your exercise as well. And a lot of people really don't think this is important, but it's crucial, not just for autoimmune prevention, but also for metabolism. You know, a lot of people say, well, I can't get my blood sugar to regulate, and I can't, you know, get my weight to come down. Well, between dark time and midnight, our body makes human growth hormone, and it releases melatonin. And both of those things regulate our blood sugar, our ability to lose weight, our mood. You know, a lot of people that go to bed late, they're depressed, or they're grumpy, they have some rages, and they think, why am I feeling like this? And it's because we didn't get the benefit of the melatonin and the human growth hormone, because we didn't go to bed early enough. After midnight, our body really doesn't release those hormones, and we don't get the benefit of it. So if we eat a Western diet, that increases our markers of inflammation by 3 times. If we eat a Mediterranean diet, it only increases our markers by 1. If we eat a seafood diet, it decreases our markers for inflammation by 1. And a vegan diet, no animal foods, it decreases our inflammation markers by 4. So the more we eat plant-based, the more anti-inflammatory types of things we'll have. The plant-based diet stimulates the immune system. It helps us resist the antigens, and it has antioxidants, which balance, it goes against the oxidation. So it doesn't mean that we have to be plant-based 100% of the time, although that's the best. But the more we eat of the plants, typically the less inflammation we see. So do you like fruits and vegetables and grains and fiber?
Yes.
Okay. Germinated seeds, those are actually in Ezekiel bread. They germinate the seeds. Sprouted, they call them sprouted seeds. If we make our own sprouts or microgreens, if we eat our produce uncooked, like salads and carrots and things like that. If we have our omega-3 fats, unprocessed would be the best. Better to have the olives. But if you have olive oil, Natalie can definitely steer you towards some great places to buy extra virgin cold pressed olive oil. And then we just want to use it sparingly, and we don't want to heat it up too much. Lemon juice we talked about to replace our vinegars whenever we can, and then focus on our plant protein. Now this says soy lowers our autoimmune risk by 60%, but I just want to clarify that and say unprocessed soy. So if we have edamame, or if we have a soy milk, that's a lot better than some of these highly processed soy foods that have a lot of salt and a lot of fat and some of the other things that would promote inflammation. Or tofu, that's a pretty good choice too. So are you a python? Do you swallow your food whole? Are you there?
Mhm. No.
Some people, they take big bites, they hardly chew, and then they swallow. So we want to chew our food and savor our every bite, because as we chew, again, it lets our body know what's coming down, and it allows our stomach to prepare. And it's a lot less stressful on our body when we're chewing slowly and savoring. And we tend to not eat so much because it takes 20 minutes for our stomach to tell our brain that it's full. And we tend to be, we don't go back for seconds. So we want to stay away from things as much as possible that are harmful, and have moderation with the good things. Weight loss, as we lose weight, we tend to have less inflammation. And then one of the new dietary things that are up and coming is intermittent fasting. Some people do it to where they fast all day and they have a big meal at night. Well, folks that eat like that are sumo wrestlers. And it's really a stress on the body to try to go to bed with a full stomach. So have a good breakfast, have a nice lunch about 5 hours later, And if you can, try to wait till the next day to eat. If you're on medication, where if you're maybe on insulin, or if you're on some medications like glipizide or glyburide or Amaryl, your body, that pill will be helping your body to make insulin 24 hours a day. So you might need to talk to the doctor, say, listen, I'm thinking about doing some intermittent fasting at night. Can you please change my medication to one that's not going to drop my blood sugar too low? Because you definitely don't want it low in the middle of the night. But that's something that I started doing when I hit menopause, because it was just hard for me to control my weight if I ate my supper. And so I stopped eating supper, just have 2 meals a day. And at first it was very, very hard, because that was our social time. That was the time that we had our biggest meal. But I learned to cook, do some meal prep on the weekends and prepare my lunches with the same types of foods that I would have for supper, so I could still enjoy them. I just had them in the middle of the day. And then in the evening, I didn't have to cook. So I actually had some time to exercise or walk, and it actually was a good thing. And now if I have a supper late, I will have reflux that night because my stomach is not used to having food. And I've definitely gotten used to that. But it's hard at first. So you want to drink plenty of water. How much water should we be drinking? Half our weight in ounces. So if you weigh 200 pounds, you want 100 ounces. If you weigh 150 pounds, you want 75 ounces. And just kind of have that throughout the day. Don't have it all at one time. And you want pure water, because when we drink our water, it keeps our blood sugar lower. It keeps our kidneys flushed and healthy. It keeps our liver flushed and healthy. It helps us to use the bathroom, have regular bowel movements, and it keeps our blood flowing properly. Because if we're dehydrated and we have thick, sludgy blood from a high blood sugar, then the circulation is not going to be good in our body. And perfect health depends on perfect circulation. We can also use hot and cold water to our inflamed joints. If we have any inflammation, we can do hot and cold treatments. And you can just look up hydrotherapy online and it'll tell you how to do that. It really helps a lot. So contrast the hot and the cold, it will actually decrease inflammation in a joint or in a body part. Or if you do hot and cold showers, it can reduce the inflammation of the flu or COVID that you're trying to catch. It helps your body overcome that. If you take hot and cold showers, then we call them contrast showers, that could increase your, it could triple your white blood cell response. So you're actually increasing your body's immune system to be able to fight off that virus. It's wonderful. It works very, very well.
Roberta, excuse me, what do you mean by contrast? Like,
Okay, so here's how you do it. You get in the shower and you turn the water on. And talk to your doctor first, because you want to have a healthy heart, right? If you can't do hot and cold, you can do warm and cool. But you get in the shower and you turn on the water as hot as you can stand it. And you stay in there until you feel your body temperature rise, like, ooh, it's getting hot. I need to get out of here, kind of hot, right? And then once you get to that point, you turn it on as cold as you can stand it for about 30 seconds and you dance around, woo! Let the cold water hit you. You definitely want to let the cold water hit you on the back of your neck, because that's where your brown fat is, and it tends to stimulate your brown fat, which helps with your circulation and your metabolism too. So you do 30 seconds of cold, and then you turn it back to hot again, and you stay in there as hot as you can until you feel your body temperature come up. Do cold for the second time, and then hot for the third time, and then cold for the third time. You end on cold, briskly dry yourself off, put some sweats on, and jump in the bed. It's better to do it at night, because you definitely need to rest after that. But if you feel like you're coming down with a cold and you drink some lemon water and you take a contrast shower, the next morning you'll feel like a new person. It's amazing.
oh, thanks. I'll try that.
Yeah, but make sure that your heart's good. If you can't tolerate the extreme hot and the extreme cold, just do warm and cool. The greater the contrast, the higher the response is for your immune system.
Okay.
But warm and cool is better than none. Okay.
Okay.
So whenever we repeatedly overstimulate our immune system, it could result in burnout. So again, if you're going to take some immunizations, try to stretch them out as much as possible and avoid as many as you can if you don't really need them. And last, we want to cleanse the system. So if you're willing to get into a infrared sauna, or if you want to sweat, you can even take your hot shower and you can sweat in the shower and just rinse it off so it's not uncomfortable sweating. But if you get your pores to try to clean themselves out, brush your skin. Chelation means that if you have any toxins in your system and you take a substance like charcoal, and this is not the charcoal that you grill your hamburgers with. This is called activated charcoal. And you can find it in the supplement section, even at Walmart or any of the pharmacies or the health food store. You can get it in a powder or you can get it in capsules. But when you take charcoal, charcoal will bind to any toxin that's in your intestinal tract and it will take it out. The only time you should not take charcoal is within 2 hours of your prescription medications or your other supplements, because it will bind to those two. But if you wait, 2 hours before, 2 hours after, and you take, just as a general cleansing, you can take 2 or 3 charcoal capsules or about a half a teaspoon of charcoal. I mix it in applesauce because that's a good consistency. It looks kind of funny because it makes the applesauce look a dark color. But about a quarter teaspoon to a half teaspoon and a half cup of applesauce, or you can take 2-3 charcoal capsules, and that will bind to any toxins in the digestive tract, and it will help to cleanse the toxins out of that tract. If you have food poisoning, if you have a stomach virus, charcoal will take care of that. And if you're vomiting, if you have diarrhea, and you do charcoal every 2 to 3 hours, it should straighten out your digestive system within 6 hours. And then we also want to have a trust in divine power. So whenever we pray or we have meditation, this can actually help with our immune system and reduce the inflammation in our body. Improved spiritual health has been shown to be an aid in stress management as well. So eating plant-based as much as possible, eating our fiber, keeping on track with our circadian rhythm, drinking water, getting exercise, sunshine, fresh air, and making sure we have circulation and trying to get rid of the toxins. This is a tremendous help in helping us to prevent inflammatory disease. So any other questions? It might be a few minutes over. Yep, 5 minutes, I'm sorry.
Roberta, could I ask you again about the high fructose corn syrup? What did you say it does in the liver? Something damage.
It has to be processed by the liver, and when we have too much, it tends to back up in the liver, and some of it may be stored as fat, so it starts to cause a fatty liver.
Oh, okay.
Yeah.
Thank you.
You're welcome. Any other questions? Was this helpful for you?
Yes.
Wonderful.
Mhm.
All right. Well, I appreciate you tuning in and listening and asking your questions, and it was wonderful to have you.
Thank
Excellent
you,
presentation,
you.
Roberta.
Roberta. Thank you. Enjoy it
Oh,
very.
you're most welcome. We'll see you next time we do a presentation.
Okay. And before you
Bye.
all log off, I put in the chat the name and the address and phone number for the place to get your flavored oils and balsamic vinegars. Okay.
Oh, good.
You
Okay.
are quite welcome.
I need to do some balsamic lemon juice, Natalie.
You need to get some there. Their Sicilian lemon balsamic vinegar is delicious.
There you go. There you go. All right. Well, thank you, everyone.
All right.
Good night.
Thank you, Natalie.
All right. Bye-bye.
Okay,
Bye-bye.
bye.
Bye-bye.